please explain why you offer endoscopic weight loss procedures instead of bariatric surgical techniques. What is the difference between the two, and when is this procedure necessary? And then, and you can also, Dr. Bashir, comment on that. And then for the cardiologists, what heart procedures do you recommend and which do you not? How about stents, bypass surgery? How about bariatric surgery? Well, bariatric surgery is for weight loss. So how about stents and bypass surgery? So those are the two questions. First, the gastroenterologists.
All right, the fun one. So first, for the patients that are on, let me tell you what that means. So first of all, most people know about a gastric bypass or a gastric sleeve, which are surgical options for weight loss. The new kid on the block, and it's not really new so much anymore over the last maybe 20 years, has been sort of an endoscopic approach. And the way I explain it to patients actually is with cardiology techniques. I say, sometimes you don't need to go as far as having a CABG. You can have a PCI intervention with stents placed. And that's sort of how we think about endoscopic approaches to weight loss. The reason they came about is because we know that, at this point, 43% of our population is diagnosed with obesity or severe obesity. But these patients are candidates for bariatric surgery to help with weight management. However, 2% of those patients actually undergo those procedures. So we have this catch-all of patients that still need help with weight loss and weight management. And that's where those endoscopic techniques came in. And so what they are is done by endoscopy. So through a scope through your mouth, meaning patients wake up they go home the same day, no incisions. And it's sort of an in-between to help patients with weight loss in the background of changing patients' lifestyle, teaching them nutrition education, teaching them about portion sizes, and sort of getting that mind on board to sort of be able to sustain those lifestyle changes. And so that's what those procedures are, either a gastric balloon or an endoscopic sleeve. There's also a device called the Aspire Assist. Also, new devices coming out all the time. One is called the Pose device that's not sort of FDA approved yet, but used a lot abroad. And so there are a lot of techniques that can be used to help patients with weight loss. And so how do I sort of approach weight loss with my patients? Because most of my patients that come in a lot of my patients will say, I've been doing everything. I've had sort of reduced my caloric intake. I exercise 5 to 6 days a week. These are all things that I've tried. And so we know, like Dr. Baxter talked about earlier, there's a lot of epigenetics that sort of play a role with sort of weight in a lot of our patients and sort of helping patients get over that hump and to get them there. Most of it is me changing sort of that diet that they already sort of have proclaimed as being super healthy and perfect. So changing those dietary things, but also patients get to a plateau. There's a bunch of theories about set point theory, about changing in the science that we've seen changes in basal metabolic rate once patients sort of have lost the weight. We know that reduces. Studies have shown us that ghrelin levels increase with weight loss. And so trying to be able to approach those patients that sort of really need help in those areas, but do not want to go as far as a surgical intervention. And so my approach is that, if somebody comes in with, a blood pressure of 180 over 110, you're not going to send them out and say, hey, you should really do that DASH diet and change your lifestyle, right? You're probably going to want to prevent them from having a stroke, so you're probably going to put them on some medication. And so my approach is sort of getting patients to that point where they're able to sort of start to see success and see some changes, because then the mind starts to get engaged as well. And then patients can buy into what you're telling them once they start to see that success. And they say, oh, I want to keep doing this thing. This actually works. I've started to change their microbiome and their processing and how they sort of approach food and life. And now they're ready to keep going. I have patients that have had a balloon and had that balloon removed. They continue to lose weight because now they like it. Now they have energy. Now they're sleeping better. Now their joints don't hurt when they go out with their kids. Now their skin is clear, which is all my ladies care about. Their hair is not falling out anymore. People are commenting, they're feeling better. They're having more self-confidence. And so these are things that that also enrich that microbiome as well, because you're feeling better. You're not having symptoms of bloating and abdominal discomfort anymore. And so you want to keep it. And I get people to sort of be able to listen to their bodies more, because now you recognize that when you go out and you have the meal that is, full of cheese and processed food, you notice that you are bloated and you go, oh, wow, that made me constipated. I paid for that thing I had a meal on Wednesday and I continued to feel symptoms until Monday. Maybe that wasn't worth it. And so getting patients to sort of slowly listen to their bodies. And so I think the other part of that question was at what point do I do those procedures? And every patient is very different. Some patients I will come in saying they really want to do those. And I think, I don't think you need that. I think we could really start talking about some of these dietary changes. I think you're on the cusp. I think you're almost there. And so I don't think you need that. If we have a patient that wants to have, maybe an 120-pound weight loss, maybe they've already lost 50 and they need to still continue to get to that point, and they have pre-diabetes, high blood pressure, fatty liver, and they really need to get out of that rut, I think that patient may be a good candidate, or if not, especially if they don't want to go for bariatric surgery. So the short answer of it is they're sort of great techniques that are low complication risk, no hospital stay, no incisions, very low minimum downtime, and sort of the new-ish kid on the block with few of us in the US that are performing them.
Thank you.
I have nothing to add to that. Dr. Laster is the expert in that field, and she covered it just perfectly. So I just echo what she said.